Good morning, everyone. It's been a while since I've done one of these videos, and what's on my mind today is Invisalign. Invisalign is one of the most fun features in our practice. Our patients really enjoy seeing the results. The results, a lot of times in people's mind, are strictly cosmetic. Straight teeth make for a more beautiful smile, no doubt, but it also can help open up your airway so you can breathe better at night if you have any snoring or apnea issues. It can affect the way that your teeth, if you have a bad bite. A lot of damage can be done to the teeth from wear and splintering off of enamel from the gum line, recession, lots of bone, things like that. And we're starting a couple Invisalign cases today, and I wanted to share some fairly big news from Invisalign. But before I do that, people always ask me in the dental chair, what's the catch? Well, there's several benefits to Invisalign. They're clear. I'm wearing an aligner right now. You can take them out when you eat. You can brush and floss with them out, so your teeth and gums stay healthier. The alternative is brackets and wires, which are obviously not as inconspicuous, harder to clean around. Some people, when they have brackets and wires, are guarding their smiles during the process. So it's just two vehicles to get to the same result. The only downside to Invisalign that I can really see is that it requires a super dedicated and compliant patient, because if you're not wearing the liners, they're obviously not moving the teeth. But that gets to the big news. Invisalign recently came out with some research that showed that instead of wearing aligners for 2 weeks and then moving on to the next set and the sequence to get from where you are to where we want to be, now we can push that number back down to 1 week. So what does that really mean for a patient? Well, another common question that I get is, how long will this take? Some severe cases of bad bite sometimes can take a couple years, but for the most part, my Invisalign patients are done in 10 to 12 months. So if we go from 2 weeks to 1 week, that essentially means we've cut the time in half. So now we're looking at 5 to 6 months to correct a lot of the concerns that you may have, or a lot of the concerns with the bite that I would have. So that is huge news, because while people don't mind the process, they're really looking for the result, and we realize that. And to cut that time in half is obviously a huge upside. So I want to share that with you today. If you have any concerns about your bite, about the way that your teeth look, what have you, please give my team a call. We'd be happy to offer a free consultation and see what options you have available. Oftentimes I feel like patients come in thinking cosmetic dentistry is veneers and crowns, whereas a lot of times they have a much more inexpensive, conservative version of cosmetic dentistry, which just means straightening the teeth and getting them really white with different whitening options that are available. So if any of that is interesting to you, please give my office a call, 970-949-3331. We'd be happy to get you in and discuss all the things that we have available to address your concerns and make sure that your smile is healthy and that you're smiling confidently. So that's a few minutes on my commute today. I will post another video soon. Have a great day.